Welcome, everyone. So grateful to have you here today. For many of you, you may come to these monthly. This may be your first time, but we are absolutely grateful for your presence in our community and in our conversation here today. So we're going to be talking about, as part of our conversations about our community, today's topic is Alzheimer's and other dementias, community solutions for a health crisis. Now, this is sponsored by the Alzheimer's Association and United Way, and we're grateful for the Alzheimer's Association's partnership with today's conversation. We are, of course, going to have this as webinar sessions, so you'll see the presenters and the panelists, but you won't see yourself. If you've not done this sort of Zoom forum before, you won't see yourself. It's not because you don't have your video button on. You'll only see those of us here on the panelists side, but you will have an opportunity to participate. There is the Q&A section and there is the chat section there. So as things may come up, feel free to engage in the conversation that way, and we'll try to monitor those questions and bring those questions in as they are appropriate and as they are fitting. So thank you again for your participation today. I don't want to take too much time, but I do want to welcome you on behalf of United Way of Lancaster County. We are grateful for the opportunity to continue this series. I'm not sure which one this is. We started out a couple of months and did a public health forum, and then we said, wow, people keep coming. Let's keep having them. So, this has been over 2 years now we've been doing this, and we are really grateful for the opportunity to bring the community together around various topics of education, economic mobility, health, wellness, and capacity building. So I want to thank my team on the back end here, Joel and Olivia, and the rest of the marketing team for their support. It's always important to acknowledge, hey, it's not me doing this work, it's them. I just unfortunately get too much of the credit. I do appreciate those team members and all of those folks here today. So I'm going to introduce our panelists here and then our moderator, and I'll kick it off over there, and then we'll get started. I do want to give you some just real quick what's upcoming yet. We do have the community forum in partnership with the United Way of Lancaster County and YMCA of the Roses at the High Leadership Center from 2 to 4 p.m. That is a community forum, again, around this topic of Alzheimer's and other associated issues. So we hope that you'll be able to come to that event. I just mentioned the time, but I realized I didn't mention the date. That doesn't help you very much. So Thursday, March 23rd from 2 to 4 p.m. at the S. Dale High Leadership Center. That'll be the Lancaster Alzheimer's Community Forum, again, hosted by United Way of Lancaster County and the YMCA of the Roses. So we've got today here, we've got a bunch of good friends here that I'm really grateful to participate. We've got Dr. Sabrina Everett, is clinical neuropsychologist at Penn Medicine, Lancaster General Health. We have Jacqueline Fisher, who's the executive director for Spanish American Civic Association. Tom Martin, who is executive director for Lancaster County Office of Aging, and Corey Strathmeyer, director of Healthy Living, YMCA of the Roses. We also then will have a presentation here by Jessica Rodriguez, who is the community health educator for Alzheimer's Association. And our moderator today for the conversation, and who I'm about to kick it off with, and then I'm going to disappear, is Clay Jacobs, executive director, Alzheimer's Association. So thank you all. Deeply appreciate whatever it is that you're doing to advance the issues of concern in our community. Thank you for your participation, panelists and other experts. Thank you for your participation, community. And with that, it's over to Clay. Thanks.
Great. Thank you so much, Kevin, and to the United Way, and for each of you for being with us today. I hope and know you'll have a great chance to not only get a little bit better understanding of Alzheimer's disease and dementia and its impact on our community, but then what so many incredible organizations right in our backyard are doing to make a difference. You'll have a chance to answer questions as well through the chat or Q&A feature. And really, I just hope that we have what is a time that helps open eyes on how we can all make a difference collectively. And it's important, right? There's something that brought you here today. But as we think of Alzheimer's disease and dementia, the context I would provide from the association is something that I think is different from even a generation ago. Increasingly, communities around the country are really viewing Alzheimer's disease as the public health issue it is, right? A pivotal and growing one that requires a robust response. While it is a disease that often impacts older adults, we know that its impact is much greater, right? In terms of its impact on friends and families and caregivers and care partners, communities and workplaces, faith communities, and so much more. Essentially, all the places that we work, play, pray, and eat feel this impact. In fact, research shows us that often community supports are the places people dealing with memory concerns go first, not to their physician necessarily, right? Not to others, but to those they're in touch with each day. And that's when we do feel comfortable enough talking about it. Research also shows us that the disease starts 10 to 20 years before we see symptoms. And so we're entering this area where not only we have the first FDA-approved treatments, but the things around risk reduction are most effective likely when we're in our 30s and 40s. And so rather than being a disease of older adults, Alzheimer's disease and dementia is something that is truly a public health for all of us. And so when we think of this, we start to realize, right, it's not that, and that is that public health crisis with all the factors that make something a public health issue. And there are a few things, right? If you know, this is not a world that you're normally in. First, there's the burden. It has to be widespread. And unfortunately, we all know too true that Alzheimer's disease is. Today, more than 6 million Americans are living with it. And in 2022, the cost of caring for them tops $321 billion in the US. And this burden is only expected to grow. The same is true here in Pennsylvania, where by 2025, there will be almost 320,000 people living just with Alzheimer's disease. And federal and state governments shoulder 2/3 of the cost through Medicare and Medicaid, never mind the personal, emotional, and financial costs. So the burden is great. We know the impact is even greater, right? Nearly a quarter of all hospitalizations of people with dementia are preventable. Further, 95% of people with Alzheimer's disease and other dementias have at least one other chronic health issue, such as heart disease, diabetes, or stroke. And Alzheimer's disease complicates the management of these, which we'll talk a little bit about later, resulting in poorer health outcomes and increased healthcare costs. And even more than that, Alzheimer's disease affects more than just the individual with this disease. There are over 400,000 unpaid caregivers, friends and family in Pennsylvania alone, which shows this impact is well over 1 million just in people living with the disease and their unpaid care partners. And those care partners provide 650 million hours of care annually. So again, burden and impact on our communities. But then there is also the piece around interventions. And that's why we're here today, is that we know a strong public health response can reduce the future impact of Alzheimer's disease by using common public health tools and techniques we use for other diseases. Things like early detection and diagnosis, impacting risky health behaviors, improving our workforce, and mobilizing partnerships across entire communities so that folks know where to turn and where to engage and what supports are available. And so we're here to discuss that, to discuss community impact and solutions around how do we improve the lives of those dealing with dementia in our communities. And I know one of the things as we were working with our panelists, and I'll check with our behind the scene wizards here, is that we were going to start off today with a presentation from Jessica Rodriguez, talking a little bit more about Alzheimer's disease. And I don't know if the folks from the United Way, have we had a chance to get her in, or do we want to kick off with something else? Because I don't see Jessica on my screen right now.
I do not have her in here. Let's see. I see Francis Gibbons being moved over.
Oh, I see somebody popping up.
Yeah.
It is.
There we go.
Hey.
Hi. Thank you, guys. Just got me in here. Thank you so much.
Wonderful. Well, then I will gladly introduce Jessica Rodriguez, who I know we mentioned in the beginning, but in addition to a whole slew of impressive personal and professional roles, it's also a community health educator for the Alzheimer's Association. So Jessica, thanks for being with us today, and I'll turn things over to you.
Well, thank you so much. I'm going to share my screen here with everybody for our presentation today. Lovely. So thank you again so much for joining today. During our time today, we're going to look at the impact that Alzheimer's has, why we're here. We're going to share a lot about our experiences are going to come up and be discussed. Notice things that our community needs, the gaps in resources, and also describe how we have access to these resources and how we can get involved. We have several different types of dementia, and when we start to discuss that as a group, the biggest question comes up is, well, what is the difference between Alzheimer's and dementia? Dementia is an umbrella term that usually means a loss of memory, And Alzheimer's is the most common form of dementia. We have vascular dementia, Lewy body dementia, and also frontotemporal dementia. And some are actually mixed, but Alzheimer's is 60 to 80% of our cases that we see. At risk, 1 in 3 seniors are going to be dying with Alzheimer's or another dementia. And that has to do with age, family history, hereditary, possible head injury, lifestyle, and it also kills more people than breast cancer and prostate cancer combined. So as we're continuing to go through, it's really eye-opening that that is what we have the most of around us, 1 in 3 seniors. And when we speak with our seniors, especially here at the YMCA, a lot of them are always sharing with us that they do know someone. So it's very eye-opening to a lot of folks. Black and African Americans are about 2 times likely to develop, and Hispanic and Latinos are also 1.5 more likely than white Americans to have Alzheimer's or dementia. And we see that they're less likely to receive a diagnosis for multiple reasons. We also have caregivers, and that plays a big role in the impact that Alzheimer's has on our communities. So people ages 65 and older usually do survive quite a bit while with the dementia. So 4 to 8 years, some people as long as 20 years. An average of 40% of the time that they have the dementia is during that most severe state. And that creates a huge impact on our public health, the ability for us to help them, and our families and the caregivers that are assisting them. So just in 2022 alone, over 11 million Americans provided this unpaid care for people with Alzheimer's. So what we see is we have folks at home taking care of their families. We have friends coming to help, and all of that is unpaid. That's adding up to more than 16 billion hours of work and over $272 billion of valued care. Right now in 2022, we have more than 6 million Americans living with Alzheimer's. But the interesting part here that I really like to point out is more than 80% of Americans really do not know much or are not very familiar with mild cognitive impairment, which is usually or can be an early stage of Alzheimer's. So where do we, as we go through, how can we help? We have a 24/7 helpline that's available. This is 365 days a year, completely free. And the specialists and clinicians offer this confidential support to people living with dementia and their caregivers and their families. We have a lot of free education as well. So here at the YMCA, we offer free education sessions. We have others all around our community here in Lancaster and York. And there's also online the Community Resource Finder, which is a really great tool if you would like to use the computer to access resources and get assistance with finding programs or finding doctor's offices. But one thing I really like to share is that helpline, because it does not matter what time of day, doesn't matter what your need is, somebody will be there to answer and to help assist you as well. Thank you guys so much.
Great. And thank you, Jessica. And certainly as folks have questions or if there are other pieces, we wanted to provide a little snapshot. But then we get to enter into what is almost that, what I hope you view almost as this fireside chat. We have some incredible organizations and experts on with us today to share more about their experience in working with the disease and so many other things. And we have about the next hour to do so. And so I'll have the pleasure of helping guide our conversation with some questions. It'll be informed by each of you too, as you have questions to add to the chat. And while we had a chance for Kevin to introduce at the beginning, as he mentioned, I'm the executive director for the Alzheimer's Association's Greater Pennsylvania chapter. I've had that privilege for the past 3 years. Certainly, as we all know, not certainly eventful years, but important and exciting things for each of us. But ultimately, our chapter serves 59 of the 67 counties in Pennsylvania. And so when we talk about some of the care and support programs that Jesse mentioned, from support groups to care planning sessions to education programs, we talk about work on state and federal policy. When we talk about things like research, the Alzheimer's Association is the largest nonprofit funder of dementia research in the world. We're on one of the most unique lists too. Out of overall research funding, we're third behind the US and Chinese government. And so not a list you'd ever expect to be on, but that is the thing. In fact, we're funding about $1.9 million in research here in Pennsylvania today. And all of that is made possible through things like the Walk to End Alzheimer's and the Longest Day. Even pieces you saw like the facts and figures, which are the expert guide on the impact of Alzheimer's disease and dementia on communities across the US. That is put out by the association. In fact, from a timing perspective, the 2023 report comes out next week. So those of you who are interested in this or watching your local news, you will likely see impacted facts and figures about the disease's impact on Pennsylvania within the next week or so. And so again, I'm pleased to be able to share so much. We had a chance to introduce our panelists before, but I think it's important you get to know us a little bit. And so what I'll do, and we'll use informally, is we'll use kind of the Brady Bunch method based on how we're showing up on screen, is I'm going to ask everyone to go around just to introduce yourself and a little bit more about what you do, but then explain how the impact of Alzheimer's disease on the families you work with. And so, Jacqueline, you happen to be top left for me, so I'll turn things over to you first.
Well, good afternoon. Good afternoon. I'm Jacqueline Fisher. I am the executive director at the Spanish American Civic Association. I've been here 16 years. I have personal experience with Alzheimer's with my mother, and as of late, I lost an aunt to the disease. And we have a senior center that's rather large. So we work with a lot of seniors that have been diagnosed with Alzheimer's as well, one form or another. So that has been my experience with that.
Thanks so much, Jacqueline. And it is one of the things, and certainly I'm sure folks who are participating today too often, right? We know those personal connections with the disease and then how it often overlaps in our communities and our work. So thank you for sharing. And Corey, as I look around my screen, you are next, so I'll turn things over to you.
Hello, I'm Corey Strathmeyer. I'm the Director of Healthy Living for the YMCA of the Roses, and I've been a part of this wonderful organization for 28 years. And as I'll probably mention when we're talking and answering some of the questions, there had been such a big shift in what the Y focus was even in my career and now. And we serve a large population in both York and Lancaster counties, and of them, many are older adults. And so you can imagine that in those relationships that we have, we are serving people who might be the caregiver, or they might be the child caregiver of an adult with some type of dementia. So we see that within our programs, within the people that we serve, whether they be members or out in the community. But on a personal level, my father and my father-in-law both died from complications of Alzheimer's. And so, on a personal level, that certainly drives some of my work. I didn't answer what my role is, but I oversee anything that has anything to do with the community health. So that happens to be policy, systems, environmental changes, programs, and so forth. So thank you so much for having me and allowing me to share the great stuff that we do in our community.
Thank you. That's such a pleasure. And certainly for that, and not only the work you do, but even as we look at that, I'm even reminded on the incredible experience and impact of our panel, because we are at folks who for 4 decades combined have had a chance to make an impact on our communities. And we're talking about Alzheimer's disease in this context. So as we look at that, Tom, I think you are next on my screen. I'll turn the floor over to you.
Well, thank you. And I also want to thank you and Jessica as well for your presentations. That was very enlightening. I am the executive director for the Lancaster County Office of Aging. I've been with the organization for going on 30 years now in different roles. I started as a care manager, progressed into protective services investigator, and then unit supervisor, deputy director, and now director. I've only been director for about 3 months, so I wanted to give you the history first, so you know. I've been with the organization for a while, but yeah, our experience with Alzheimer's and other dementias, as you can imagine, is quite extensive, just with the consumers that we work with, as well as the caregivers that are caring for those consumers with various degrees of dementia. And we see it in many of the different services that we offer. The caregiver support program comes to mind. That is a program that can offer assistance in respite for people with Alzheimer's, for their caregivers. That's one thing that comes to mind that I think is really good to note. And we also see, unfortunately, we see a lot of it with protective services, where there are the consumers in the community either themselves not able to take care of themselves, or the caregivers that don't have the education and ability and the know-how to care properly for the consumers with dementia. So those are two big areas that we see that a lot in. Hopefully that's helpful for starters. So.
Yeah, I think that's a great snapshot, and I'd be remiss if I first didn't say congratulations.
Yeah.
3 months in, and you get to celebrate with us a little bit as well. I'm sure it probably feels like it has flown by, and as you look at all of the work you've done, but to help families around this cause and so many others. And so with that as well, our final panelist that I'll turn things over to is Dr. Sabrina Effort. Sabrina.
Thank you, Clay. I am so happy to be here and hear everyone else's story and backgrounds. I've been with Penn Medicine, LGH, for the past 3 or so years within this system. And I'm a clinical neuropsychologist that's involved with the Alzheimer's and Memory Care Clinic. So often we are not only diagnosing different types of dementias, but we're helping both the individual as well as their family to navigate what that looks like going forward. And in some roles that just involves getting them connected to some of the services that have already been mentioned, helping them with medication management, and in some cases, speaking on their behalf if they are needing guardianship or any additional oversight externally outside of the home. And we can often lend some information to that process and have that happen more smoothly.
Wonderful. Thank you so much for that. And thanks to each of our panelists for the introductions. And even as we go through it, it made me think of, what the United Way was able to bring together today. And we did officially cross what is a century of combined experience in this work and working with communities as we look at that. And so I think as we talk about some of these conversations, it's certainly something where Alzheimer's disease and public perception of it has changed through the years. And so as we go through, what I'd encourage panelists to do is to open up the line as you want to speak to this. Rather, I don't need to touch on, but as you think of that in your careers or tenures, or even in your lifetime, how have you seen public perception about this disease shift? How have you seen people engage? Has it impacted, we certainly, a number of folks identified personal connection, but the fact that we're talking about this today is certainly an indication. And if anyone on the panel would like to speak to, how have you seen behaviors or perception of Alzheimer's disease and dementia change in recent years from your perspective?
I don't mind starting, just to speak to some of what we've seen as far as previous, stigmas and stereotypes, similar to a lot of other, I guess you want to say maybe social issues or public issues. One being like mental health issues. Just the more you're seeing more public communication and education as far as like breaking down some of those barriers that the dementias are more accepted now. I think of hearing loss also. I mean, I can even think as far as 10 to 20 years ago, if you had hearing aids on, you were marginalized. They're just examples I'm giving, and I believe that the dementia diagnoses, and there's still a long way to go, but I think that they're being more publicly accepted and addressed. And I could be wrong. I mean, that's just been my experience, but people are more willing to acknowledge, both in their loved ones as well as themselves, that they may have a diagnosis along these lines, and maybe even try to seek out the assistance that is available to them, as compared to in years past where it was just kind of like tucked away, or tried to remove from the community. So that's just what I've seen.
Yeah.
I'd like to say something in respect to that. I have 2 points. One, on a personal level, I know for me, it was denial. So it wasn't as though I didn't see signs and symptoms. I just attributed that to old age, right? So I was in denial and uneducated about the disease. And working in the field here at SACA, we see a lot of people that come in for mental health treatment, substance use disorder treatment, and those stigmas still exist. But with the Black and Brown or Hispanic population, I have noticed that they're not as open to accept this, right? From my experience, I speak, that they don't want to talk about it in public. There's the Uncle Joe we keep at home in the back room, and he's just a little crazy because he's old. And we can't talk from the Black perspective. We can't say that we have Alzheimer's. There's nothing wrong with it. It's much like we don't have a mental health diagnosis. We don't have depression. And I think it's a barrier that we have to continue working on. And although it's in the public, I think we have to bring it to areas of more urbanized areas that concentrate on those 2 factors.
Yeah, thanks, Jacqueline. I think even in that, right, there is the piece of, you mentioned that, what is normal aging? What is Alzheimer's disease? What's another concern? You also mentioned some of the cultural stigma, which we'll get back to, but I wonder, Dr. Everett, as you see folks, from your perspective, yes, on perception, but that idea of what's normal aging versus what isn't, do you see that in clinic, or have perceptions changed, or what are some of the things you see from families and individuals?
I see that there's often concern when the functioning starts to be impacted. And if the person is diagnosed when they're well into, or if the symptoms start to be expressed when they're considered to be in their later 70s or 80s, often it's attributed to aging, kind of what Jacqueline is saying. When we're seeing folks nowadays who are being diagnosed sometimes as early as 59, it's impacting their life in a way where they're still wanting to do a lot of the things that they're noticing they're not able to do. And they're much more comfortable with it being a diagnosis that is not Alzheimer's. And we often get to provide education and say, look, you can live a life that's going to be more effective if we can support you in understanding what it is and how we can navigate it. And after that education, there seems to be a warming, because I say, look, that label is how we know what to do, but it's really not the label that matters. It's your experience and how we can work with you on that. But for the folks who have a lack of understanding around what it is, and really have a stigma around identifying with that kind of a diagnosis, it's very challenging for them to come to terms with, or even engage in services in a meaningful way, because there's just a rejection of that as being something that they're willing to accept and admit to having.
Yeah, absolutely. And I think that's, and appreciate that. And, part of this conversation is those different perspectives, and what do we see and how do we connect? And we know some of those things, right? Is the reaching out to seek a diagnosis often in an acute situation or an uncertainty, and all of those things that come along, as Jacqueline mentioned, even cultural considerations for it, right? As you were telling that story, I was thinking about a barbecue within our family where my great aunt had been diagnosed with the disease. The family hadn't told anyone, and she came to a big family gathering. There were about 60 of us, and I could tell something, she wasn't comfortable, and they weren't sure how to interact and all of those other things. And that is within my role. I've been with the association for 15 years, and even within our own family, it was, well, that's a great aunt and you're the youngin', right? So we're not going to come to you because it's a generational piece. And, Thankfully in that case, about 2 years later, so in fact, this past summer, we got together, again, hadn't talked to me about it, had ended up calling our helpline, had gone to support groups and others and interacted. She had a better experience, all of those things, but it is that education component inside of it. And often that goes to as we mentioned, this is a disease that can be isolating, but I think in all the comments we mentioned, it's that connective side. And so, maybe Corey, starting with you, from your perspective, with Alzheimer's disease, with dementia, what kind of impact do you see on the families you work with, or the families you've come across impacting this disease? And then certainly we can open up to others.
Well, I think just from the beginning with Jesse's presentation and your opening remarks, it can be a really big barrier and for people to find help. And so there's this frustration and lack of understanding. If I can back up to your question really about the public perception, I think it ties into your question now. And that being that with an increase of dementia within our community, there are more people that are at least becoming aware. And as soon as we start to have that recognition and that little bit of awareness, then there's that opportunity for more, the more resources and the more opportunity to get this information out, the awareness will increase. And as we're doing that, then we're able to connect people to resources. So I think with the public perception, there's starting to be a little bit more of an awareness, but there needs to be that education piece. And so what we're seeing at the Y and in some of our other collaborations that are not in particular focused directly on Alzheimer's or dementia, but we are seeing frustration, some fear, just uncertainty on a lot of different levels. One, where do we go for help? How quickly can we get help? Who can help with the care? I hear a lot about that caregiver piece. And I can say even in that personal, I'd like to think I'm educated. So my background's public health. I'd like to think that through my education, I would know how to get help. And it was really challenging with my father who passed away 4 years ago. So I can empathize with our members who are unsure of where to go, or I can't even get into healthcare. I can't get a diagnosis. So we're hearing a lot of barriers, and the Y doesn't necessarily have the ability to make all of those connections or help with that, but we want to be a part of that process.
Thanks, Corey. So well said. And I will point, because I know we're getting some questions in, we will absolutely address questions in chat as we go along too, as we find opportunities. So feel free to keep sending those questions in. We are keeping an eye on it. But to that point, and what we just touched on, I see Jacqueline, you unmuted on that impact on family and accessing services. Certainly something there seemed to spark.
Well, I thought back to when my mother had her diagnosis. I mean, things increasingly became, worse and more forgetfulness and so forth. So I went to LGH geriatric, and they said, well, no, I lied. I went to the primary care physician who did a 6-question test. He's like, yeah, I think she may have Alzheimer's. And I'm like, no, that's probably just something because she's getting older. She's 78 years old. But then I went to LGH and they did their testing and they showed me the images and they said, absolutely. But as a caretaker in that role, I felt as though I had just lost my mother. I felt like they had just told me my mother died. So I know that, and I consider myself to be educated and, all of that was out the window. I was in shock. I said, my mother, for me, she was going, what do I do now? Where do I go? They gave me information for Alzheimer's. They gave me a bunch of pamphlets. But when I went home, I didn't look at anything. I grieved the loss of my mother. So I think trying to help caretakers understand, digest, and come to terms with that would help with the education getting out as well. Being able to take care of the person that has been diagnosed. But caretakers definitely do have the initial shock because the patient isn't really aware of what the diagnosis is, right? Just a comment, just a feeling I had then, sorry.
No, hey, that's the hope. This is an open discussion for, and even as you mentioned that, right, one of the things that strikes me is we've talked a couple times around normal aging versus not. Alzheimer's disease and dementia are these diseases, right? They are progressive diseases where we see the person we care about changing. And yet it's hard to think of what are the underlying biology of the disease, right? That it is actually their brain changing and going through it. And even as we think of some of those images in Pennsylvania, some of those first images were developed in Pittsburgh that help our understanding of the disease and research and others. And so, but it is that, right? And that impact on family, we've touched on a couple of ways, even that experience there. Tom, Dr. Everett, from your perspective on families, right? How do you see that impact of this disease? Starting with, we're talking about community, but that's probably the closest and tightest community you have, even with all the ups and downs, is family or families of choice. So anything you had on families around folks?
Often when we are doing diagnostic work, I can speak to our clinic that we have here, we're often looking to diagnose the patient so that they feel like they know what's going on. Because often we're seeing folks who are saying, this is happening and we just don't know where to turn because we don't exactly know what it is we're dealing with just yet. So we have a time where we have folks come in for a diagnosis, and then we have a second appointment where we are just focused in on what is going to come next and setting the tone for how we're going to help the families feel like they're navigating things in a way where they're supported. And kind of again, to what Jacqueline is saying, there is a time of processing, that immediate understanding of what is happening. And so there's usually a few weeks in between those two appointments. And usually by the time folks are coming back in, they're flooded with questions because they're saying, what do I do? What do I expect? And usually we can sit down and say, this is the information that we have. These are the things that we can do to treat from a medication perspective or lifestyle factors. And down the line, when you may need additional resources for in-home support or transition to different living situations, we can be someone who you can come in to see or even pick up the phone and call. And I find that family will say, oh my goodness, I just feel like I have an understanding of the path. For folks who are diagnosed in a way where it's not in a clinic, it might be more challenging because the resources are then provided, but there might be more weight on that individual who's still very much processing what's going on to navigate and get connected to those resources on their own, which they may or may not have that bandwidth to do at that time. And so that can present a challenge. And needing that additional support, I think it really makes a big difference in the experience going forward.
Thank you, Dr. Everett. Tom, anything on your perspective? If not, we've opened up a couple of avenues that I'd love to pick a little further on.
Yeah, no, I was looking at the chat and I see the response there with Adult Protective Services and the need for more education regarding the progression of the disease as well as the caregiver support. And yeah, I mean, it's what kind of speaking to what Jacqueline was saying too. I mean, I have my mother's 86 years old and she's always been sharp, like cognitively. And just recently noticing her like in conversation and repeating something that I know she told me, not very long ago. And, it's just kind of one of those triggers for me. It's like, mom, you're starting to slip, I mean, I can joke with my mother and tell her that she, was a registered nurse and, knowing that I am in the aging field, we can banter like that. And, but what we find a lot too with what we refer to in protective services is sometimes it's an unintentional neglect in that it's based on the lack of education and just like they would never treat their family member that way if they really knew what was causing. They think that sometimes it's behavioral, it's like they're just being stubborn or if they have some kind of incontinence, well, they did that just to get back at me, that's an extreme example, but and sometimes there's the combination of the different medical situations, and again, going back to the denial piece with, people saying, well, maybe they're sick, or, maybe it's a combination of their medications. And there's some truth to that, but just again, the acceptance of the actual diagnosis is challenging for family members. They can get all the education you want, but when it hits home, it's a whole different ball game. So
yeah, well, and so much of what we talked about just now, and Dr. Everett, you even mentioned, right, the difference depending where a diagnosis is received and others. But maybe let's pause there, right? So I mentioned earlier, as we talk about that public health side of things, where early detection, diagnosis, or mitigating risk, and some may not be, we're probably a year to 18 months around seeing things like a blood test for Alzheimer's disease be available, and things that change. But today, right, as we look at detection and diagnosis, I would pose to whoever would want to start, why, from your perspective, is it important? And then maybe the follow-up question is we'll pose around what are some things that either you've noticed or you think is important to lay out, but maybe starting with, why is early detection and diagnosis important in this disease or with any form of dementia? And I'd open up to whoever wants to open their line first.
I'd be happy to speak to that. I often think about it as something that folks understand very well: high blood pressure. So often when you're diagnosed with high blood pressure, if you're in the full-blown high blood pressure range where it's not on the cusp and you can't reverse it with, just kind of getting right back on a diet, the go-to is prescribing some medication to help manage it, and also effective lifestyle management. And when we're thinking about something like Alzheimer's disease, or we're thinking about other types of dementia, it can be thought of really in a similar way, where we can work with folks to effectively make lifestyle changes, looking at medications to essentially enhance their quality of life. So, if you're going to get access to the right services and the support, and also support for the folks in your life or caregivers, it really is going to change conditions in terms of how quickly the progression happens, planning for the future. It can eliminate the possibility of other potentially treatable conditions that often co-occur with dementia as a result of not having the original dementia diagnosed and understood. And overall, you're going to see statistically, from what research suggests, just more independence over the span of life because of the initial management at the beginning that's going to help to control some of the other factors that can contribute to that quick worsening of symptoms over time.
Wonderful, thank you. Anyone else, as you look at that early detection from your perspective as community organizations, or even as you've seen that evolve in your work? And I think one of the things as we look at the Alzheimer's Association, it so much connects with, as you mentioned, some of the stigma earlier, right? Even as we look at in research settings, for decades, research on the disease was done as folks progressed and were diagnosed or shown symptoms, and then we're trying interventions. And yet, if we think of the disease, what we know now, starting 10 to 20 years before we see symptoms, research was done, things were changing, and we weren't starting research on disease intervention or treatments until 2 decades of progression. And so how do you make a change there? And so lots of what we talk about is, early detection, diagnosis, so many of the things Dr. Everett mentioned, but the future on things like, what does it look like a cholesterol test to be able to identify biomarkers and start a course of treatment, to be able to plan, to be active in some of that planning, and how big a difference that would make, right, as we look at our families today. And I think some of the things, and I'll pause here, I know we have quite a few questions that overall to touch on, but there are a couple of specific questions that have come in through the Q&A that I'd love to lift up if anybody, would want to address or be able to address them. And some of them have similar themes. So we have one that comes that my dad passed away in 2021 from COVID. A year before he died, we moved dad and mom to a retirement community. Since dad's death, we've seen a significant increase in mom's dementia. She's still living in their apartment, but her primary care physician took her license to drive, Mom gets agitated a little bit more easily and her memory is declining. She can still care for herself, but what are significant signs that it's time to look at other levels of care? And so I know we have a couple folks who may be able to weigh in. I don't know, even Tom, as you see that, we've seen a couple questions that are really around transitions in care. And so maybe from the perspective of the AAA, as you look at that and some of the work you do.
Yeah, to speak to the signs and symptoms of when you may need to move to the next level of care. That's a tough one. I mean, it's easy for me to speak about, but to actually do it with your own loved one is very challenging. But what you want to look for is risk factors of harm to themselves or others. For example, you use the age-old leaving the stove on, or having candles burning, or something that's going to expose them to a risk of to their own health, like a fire hazard. If there's a lot of clutter and they have clutter on their radiators, or whatever is going to, if they have faulty electric or things of those along those lines. Some of the quick, easy fixes, if you want to say easy, but again, that gets in a whole nother issue with caregiving and having somebody checking in on them on a regular basis. If it could be even, like a friend calling daily just to start is a possibility, just to get some eyes in there, just to see, and also to monitor how the person is progressing. I mean, we've had people that have been alone in their home, and we'll get calls from the neighbors saying that they shouldn't be there. And we say, well, why shouldn't they be there? Well, they're old, and they're, I have one that from when I was in my protective services days, where a neighbor called in and was complaining because somebody was using a flashlight and they were checking their garden at nighttime. And I said, well, what's wrong with gardening at night? I mean, it doesn't fit in the norms, but there's really no risk to anybody unless there's somebody shining their flashlight in their windows and telling them that the aliens are chasing them or something like that. That's different. But if somebody goes out to check on the size of their tomatoes at night because they had been doing something all day long, what's wrong with that? So that's just one example I can give. But and it's also nice to see, the names of the people who are offering the questions, because it kind of gauges for me. It helps me. I know some of these people asking these questions, but I don't want to move on to the other one. I'll let you facilitate that. But hopefully that was helpful. Some of that feedback.
Yeah, and certainly, and one of the things that I see some of the themes. So we see questions in the chat and Q&A. There's a category around accessing information that I want to be able to touch on, but any other thoughts as people look at transitions in care, or some of the things either to look for or ways your organizations help? I don't want to move beyond that if there is any other input for folks.
I will also comment, Clay, that often we're looking for self-neglect, kind of to what Tom has already shared, in the event that there is a lot of family resources that can often allow for folks to really stay in their home longer, because they can have more oversight. They can spend time with mom for a few hours a day, things like that. But if there's concern that the individual is unable to safely navigate just the basic necessary, what we call ADLs or IADLs, their independent daily living functioning, that requires them to be able to upkeep their nutrition. So some folks will have food delivered, and then you go back to deliver the second batch and the first batch hasn't been eaten. So things like that, whereby you're starting to have concern for the reliability of them to be able to navigate all of those basic things on their own. That's maybe when you want to start thinking about transition, which that might mean transition to having someone come into the home a few hours a day, transition to living with another family member. And it also is going to depend on that individual and how willing they are for these supports. Some folks culturally are just not happy to have a stranger in their home. And so you might have no no recourse but to have a higher level of care in that case, if there's really no middle ground that you can find. And through LGH, we are often providing different information about how folks can get the skilled nursing in home, or if they need to transition to living with a family member, kind of helping them to navigate those things.
Wonderful. Oh yeah, Jacqueline.
If I can comment on transition, so it brings to mind my mom when she lived by herself, and those signs Dr. Everett spoke of, I started to notice she cooked for years, always cooked. When I stopped by every day, there'd be a meal cooked, still cooking like she had a house full of children, right? So I started to notice there was deliveries there. Every day there were subs, there were hamburgers, but there was a hamburger on that. Just what you said came true. So that's when I started to realize that probably she shouldn't be here alone. Gave it a little bit longer. She started having auditory and visual hallucinations. There's someone in the basement, so forth, so on. So I brought her to live with me. That was the first transition. She would not let anyone in the house, didn't trust anyone. So then she came to live with me. And it was 3 years until her primary care told me that I need to think about a nursing home, because I couldn't, my culture, absolutely not. So for people that are listening, you may want to release some of those old beliefs and customs, because you're doing more harm not being available for the person by hurting yourself physically and mentally and emotionally, than letting the person move forward. So I went to look, I reached out and I got help and found a home that I felt comfortable with, that actually wasn't far from my house. But to that effect, the cost of nursing homes is so high, and people aren't planning or preparing for that. So I think looking at more centers of excellence in nursing for homes, rather than homes that we're just placing someone there and they're in a home and they're fine. So maybe Martin, your agency goes out to check those places, but there are several transitions is what I was getting to. And each one of them is just a little bit harder than the first instead of easier, if you understand where I'm coming from.
Yeah, and thanks for sharing that experience. And it's such an important thing. And when we look at this disease, and I'm going to connect back to the chat too in a second here. We know that 70% of people live in community at home, right? And so when we look at those transitions in care, often they're done when it's an acute situation. Something's happened that's prompted it. And yet we also know things like outcomes are better when folks are connected to local resources and feel embedded in the community. And the example, I see one in the chat from Kevin around Meals on Wheels, right? Being a place that helps reduce a lot of risk around things like fire and forgetfulness. Jacqueline, you were just talking about food. Some programs can even do things like medication reminders. I'd turn maybe Corey to you first on, as you think of that and the vital role your organization plays in the community, some of the things you've done to help access information and resources and help work with families when maybe in the earliest stages, or just to talk about things like brain health. If you could share a little bit about those, because some of the other things in QRA are access to information and education and support, but often we know that occurs right at the community level in our backyards. And so if you could talk a little bit about what you've done at your organization.
Sure, we are not healthcare experts, but we like to be partners with those who are. So if you can indulge me for a moment while I talk just a little bit about the why history, because I'm willing to bet a lot of people don't understand why the YMCA is even a part of this conversation. So our YMCA is one of the oldest in the country. So we've been around since 1840 or 1855. And early YMCA philosophy was really focused on spirit, mind, body, which is still where we are now. But we talked and focused our programming a lot on that physical health, exercise, right? Most people think of YMCAs as gym and swims and exercise and so forth. Well, we made a really, really big shift in 2007. And that's when we started to rethink about what that spirit, mind, body meant. And we coined, and this is at our national YMCA level, we coined a term called health seeker. And a health seeker is anyone seeking better health. So that's all different. We're all health seekers. We're all interested in improving our health in one way or another. It might be physical, but for me, it's always about better sleep, more sleep, right? So we all have something that's we're seeking to make us better. And so we made that shift, not that we're not encouraging exercise and so forth, but we started to develop and implement targeted programs for specific chronic conditions or specific health conditions. And our flagship program launched in 2010, which is for adult cancer survivors. And then we've progressed since then. And as we added, and by the way, every program that we offer is evidence-based. It's based on research. It's not something that we made up. It's something that we've partnered with other national organizations to develop a program that could really be helpful, or an awareness campaign and so forth. So I'm sharing this because as we've moved forward with some of these programs, we're working with a lot of older adults. And so we're seeing dementia. And one of our very successful programs focuses on adults with Parkinson's disease. And so we know that through Parkinson's, some people do have dementia, whether it's from medication or from their progression of their disease. And so where we fit into this is that education piece, that awareness piece, and then trying to link to resources. So this panel today is going to be really, really instrumental for the Y to be able to find even more resources to be able to connect people. So where the Y comes into this is we want to help to be a voice. We want to be an organization that is linking other organizations, other businesses, partnerships, and so forth to help to educate and build that awareness, but then also for those resources. So we lead a lot of collaborations, and some of these are very unlikely partners, whether it be, it's multi-sector collaborations of businesses, education, government, elected officials, and so forth. So if we are passing that same message along with the rest of you on this meeting today, then we're just amplifying that message and we're trying to get that out. And that's really where the why is. We want to be that connector and we want to help to educate. And so we do provide programs from the Alzheimer's Association. And this past year, we reached about 200 people in direct classes. So that's offering brain health and classes specific to what is dementia, what's the difference between dementia and Alzheimer's, and so forth. But then we've reached, and it's really hard for me to measure, sorry about that, to measure our reach through other avenues, us having information in newsletters, connecting it, sharing it at board meetings, and not just our Y board meetings, but those collaboration boards that we're leading, and that crossover with other health conditions as well. So we are just constantly sharing and hoping it sticks. And I think that takes time. It takes a lot of time and a lot of repetition for that to start to connect. And then when people do have the unfortunate situation that a husband has some memory care problems, maybe that starts to connect. That's right. I heard there was something in the Y newsletter and I saw something at my doctor's office and so forth. So I think that's where we fit the best. We are not healthcare professionals, so I'm very hesitant to offer any information on that, but we want to be able to refer to those who are those experts and those who can provide that boots on the ground resources as well.
Yeah, well, and that connection point, right, is the piece, is that we started with the idea that often with cognitive issues, folks don't necessarily go immediately to the physician. They go to the community events they're at, they go to their church or their faith community or their neighbor or their walking group or sometimes their workplace. And so knowing then that they can connect you is really important. And in fact, we see that question. I see a question in here that goes to, thankful for the information from Sheila Beasley. I especially appreciate Jacqueline's comments because she expressed how I feel right now. It's difficult to process with my mother. And while Sheila lives in Allegheny County, I know in chat we'll also send some additional resources. The question she asks is relevant for anyone, right? Are there places where you know you can turn for support? And so I'd open it up to anybody on the call, right? Corey just gave some examples about how the Y is serving in that as a place to go for support. But for others, are there places that you know in Lancaster County or duplicated across the Commonwealth that are really important to go to for support, or if you have questions? And I'll open up to the group first.
I think the Alzheimer's 24-hour hotline is a very good resource when you are in need of help. 10, 11 at night, you're just stressed out and need someone to listen. They're available. So that's one good starting point and easy enough to remember offhand, if I was to say.
Hey, I appreciate that one. And for folks who don't, it's 800-272-3900, 200 languages and dialects available to call anytime. I will also admit there are times that if I can't sleep, I will call just to see how they're doing. So that 2 a.m. call just to say thank you to folks because they are 24/7, to then connect to local resources or just be a shoulder to listen to. How about others though? Tom, as you think of it and the role of the AAA, or Dr. Everett, are there things as you think of locally that folks often access or turn to for support or for information?
Yeah, to speak to that, we also, the Office of Aging, we have a 24/7 on call for protective services, which is 717-299-7979, which is our general number. But that patches to a communication center, and then there's a worker who is on call that will return the call. Yeah, I mean, it is 24/7, you know, there's not much we can do at 2 o'clock in the morning, but we could definitely be following up first thing in the morning. And that's for something that might be of a safety risk or of a concern that needs to be reported, that might not necessarily rise to the level of the police or 911. You know, because typically if that is the situation, then we will educate the caller to say, well, you're going to want to call the police or you're going to want to call the ambulance, but it is available. So just to put that resource out there also.
And just to add to what's already been said, we will actually usually connect patients to some of the things that have already been mentioned, but we have on-site social workers who usually, once a patient receives a diagnosis through LGH memory care, there is kind of interval follow-up, whether it's just over the phone to help them with kind of making calls and connecting to different services, or having them just come back in to do a check-in to see how folks are doing. So we could have hands-on with them where we're trying to just make sure that if questions are coming up, we have an open line of communication. And so folks that come here are within the Lancaster County or even beyond, and we have folks who just work with them one-on-one to be able to navigate based on their specific area, because there are a lot of different support groups, again, depending on staging. So there are support groups for those who are in the early stage. We have memory cafes for folks who just kind of want to not only get information, but to have something routine to look forward to. And we often have caregiver support groups that can be attended through Zoom. So all of those resources are available, but really based specifically on where you're living and where you are.
Wonderful. Thank you for that. And so we have about a half dozen questions in the chat still. So I think we can stick with some of those. I want to be able to respond to those who are with us. I also think there's one of the comments here that, to me, days like this are really important, that we take something from this, because we see from Ellen Bear Fund, I think there's a lot of fear surrounding Alzheimer's and dementia, and people don't want to talk about it. If we can get to the point that we can talk about it in the same way as we do heart disease or breast cancer, there will be more understanding and acceptance. And so I would agree, right? And I think that's, as we end today, even we'll talk about the charge to how do we share things like today with others? How do we share this experience? But as we look at some of the questions, I'll open up, and some of these do have, and Dr. Everett, I say some of these will cue to you because some of them are very specific. So one of the questions, and certainly both of my parents died with dementia. Am I more likely to develop the disease? What tests and treatments are available today to diagnose this disease?
And well, who is that question from, the name?
So we are, and sorry about that on the Q&A. It's a little hard to see.
Oh, no, it's okay.
But from a Barbara Zurcher,
Okay.
and I apologize, Barbara, if I mispronounce your last name.
I was going to send a message, but yes. So when you have something like Alzheimer's disease, there are some folks who, if they are with family history, especially if there's an early onset, meaning folks who are being diagnosed in their late 50s and early 60s, there may be a genetic component. But I can say with certainty that there are many, many folks who have both parents with a history of having had Alzheimer's disease who never develop the type of rapid memory loss you would expect to see in someone who has that kind of a dementia. While at the other side of that, there are folks who have no family history of Alzheimer's disease and go on to develop Alzheimer's disease. I would say if that is a concern, while I certainly understand why that would be the case, there are certain things you can do. Some folks will go as far as to get genetic testing to test for things like genes ApoE4 specifically, where folks are seeing that gives you a genetic predisposition to developing something like Alzheimer's disease. And there are folks who often will go in and get what we call baseline assessment, where you're kind of taking the initiative to go and evaluate your cognitive abilities to see if there's anything that stands out as being, challenges in thinking that go beyond normal aging. And that way, you're able to actually feel like you have some understanding as to how you are thinking, and someone can give you some more certainty as to what is or is not going on.
Wonderful, thank you. Anyone else, either from that perspective or even personal experience around diagnosis, would certainly open it up to any of our panelists. Or if you've been through that and are willing to share, right? Are there important things on how you've had that conversation or how you engage with the physician or others around diagnosis? And if not, I would certainly say for anyone on the line who's interested in that, also at the association, things like how do you partner with your doctor, have these conversations, is something we can always help with. So you have an idea, and right, it could be a stressful situation. So how do you have those conversations? How are you keeping track of some of these things? So I know we have a couple other questions in that I think we can probably circle back to in a little bit. But as we look at this, from your perspective on Alzheimer's disease and dementia, we talk a lot about community, and right, that's the context of why we're here, and with community organizations embedded working locally, even if it's anecdotally, how have you seen either incidents or dementia impact in Lancaster County? And from your perspective, why is this kind of community-based approach a really important way to address and support others? So I'd open that up is if you've seen that change in your work and kind of why you've committed to doing things with your organizations, or right, with a state organization, really expanded some of those things to make a difference for folks in their own backyards. And maybe as we look at it, I know, Corey, we talked a little bit about the why. Jacqueline, as you talk about some of the work at the Spanish American Civic Association, how have you addressed or helped connect with those related to dementia from an organizational standpoint? Kind of what was the impetus behind that?
Well, I think in one case in particular, it was a caretaker that reached out looking for mental health treatment here at Nuestra Clinica because of a parent that had Alzheimer's. And she reacted by calling the police because she was afraid for her own safety, and then felt remorse and called us. But at that point, I think more community enlightenment is needed, especially with the police force as well, because they ended up throwing the man on the ground, and they didn't know that he was he had this problem. So just if everyone just had more education, if we shared this among state and local agencies other than just ours in this community, so that everyone had some idea of what those signs and symptoms look like, that maybe, we were able to help the caregiver, but the other the parent or guardian, whoever it was, had to go into treatment, of course, into a home, but we could support the other person with the mental health treatment on the back end. So making sure that everyone has a little information to start, and just flooding, as you've been doing and doing a very good job at, just keep flooding the airways and the papers and so forth with this type of information to teach us all. I learned today, Dr. Everett taught me something, I mean, the more we talk, the more we learn. I think people should not be afraid to ask questions. I don't care that I'm a panelist. I have a couple of questions I'm going to send to her. So, you know what I mean? You just grow from the more you know. My mother is still alive, so I have questions about those things. And, I just think, and one of each person helping someone will help the majority of us, basically.
Yeah. No, I love that. And that is, I mean, some of the things we've seen are just how do we reduce stigma to have a place for conversation, right? And if we don't know, how do we work together? And even as community organizations, how are we listening to, and I know in the chat they'll share, and Kevin started us off about things like the community forum on dementia coming up later this month, talking about the opportunities and barriers and how we can work together to resolve some of those things is important, right? Because that's how people connect. One of the things you mentioned in there, Jacqueline, is visibility to resources available. And I know, Tom, you've talked about that quite a bit, but maybe that's something at the local AAA level. How do you go about sharing information about what services available, or even if there are participants on this call, how do they know if they were to share with their network or get a question, what services available are locally through places like the AAA?
Yeah, and you touch on a very important subject. Just with part of our 4-year plan with the state is community outreach, and participating in such things as this, the panels and the forums, and our agency's involvement with different organizations across the community. We do with Age Friendly Lancaster. We're also part of the United Way. Or we have partnership, or I might be not using the right terms, but definitely involvement with United Way. And there's also the Dementia Friendly Lancaster, the Alzheimer's Association. We have the Lancaster Downtowners. So all of these things, and again, I'm just now starting to have that exposure and being on these panels, and I feel a little vulnerable just knowing that I am not the first and foremost expert on any of these subjects or fields. Just being able to share our experience with the community, and being able to make those connections, and that people will feel more free to reach out to our organizations and see if I can't answer the question, I'll make sure that one of my staff can, or we'll do the best we can to answer that. So I hope that answers your question.
It absolutely does, and I think highlights a really important point of that, whether on this panel or in the audience or even not with us today, expertise around this disease is widely varied, right? It's a disease that's progressive over decades. And so things that are important today, from risk reduction and others, pre-symptomatic, all the way to hospice and late stage care. And so agencies and organizations and partners and where people engage changes. Right, it is one of the unique facets of this disease that makes it a public health issue, is that journey is long and ever changing, and so we all, when we have these conversations, learn something from it. And so, as I think of that, there are a couple questions here, and certainly if folks want to put in any more questions, but one that comes up is around research, and this may be one I don't know if other panelists will want to be able to answer, but I think it's an important one. And so folks will, and if not, I could speak to it briefly, but we see some of the things, or what kind of research is being done among dementia in younger people or adults in the community that has an impact on the future. And so certainly, research is an area we may not want to step out too far, but Dr. Everett, maybe there is something as your perspective on research, and then certainly I could lend some additional context if helpful.
Certainly. Well, clinically, we have kind of been given the full stop to avoid talking about too many different kinds of medications, but often that's where the focus has been given to trying to understand what medications can be prescribed to folks at earlier ages. so that they can actually benefit or see greater benefit from having the slower memory decline over time. The other piece of it is often, and I can probably speak a little bit more freely about the actual risk factors. And so what are the different types of things? Like some folks are having some studies with what we call microangiopathic changes to the brain, where there's concern that folks who have had long-term poorly controlled diabetes and other cerebrovascular risk factors like high blood pressure and unmanaged cholesterol, that the deep areas in your brain that are sensitive to reduced blood flow can actually put you at greater risk for developing dementia later on. And again, studies are looking at that in addition to the comorbid or co-occurring sleep disruption, high stress levels, emotional disturbance, all of those things together in connection and separately are impacting the brain in a way that's making it more vulnerable and more susceptible to developing more chronic dementing processes that often are showing up years and years later on, without getting too much into the weeds.
No, I think that that's incredibly helpful and hopeful to the folks who answered the question, because there's another piece I'd lend to context to the world of research is that we know the largest funder of dementia research in the world is the US government, actually through the National Institute on Health. And from 1980 until 2011, that funding had stayed flat, right? And actually about a penny for every dollar spent on cancer or heart disease research, all worthwhile aims. But so what we saw is not much movement in our understanding of the disease. And then in 2011, you started seeing increases in that funding to now having increased almost eightfold. And so when we talk about that from the baseline or understanding of the disease and the hallmarks, we talk about interventions, diagnosis, risk reduction, all of that. You likely can't go a week without hearing something on the news around, hey, here is something about a research trial that came out. Part of that is because there's more research being done than ever. The fact that there are FDA-approved treatments, that there are others coming through, that things like biomarker tests and blood tests are realistic things we're talking about, and that even people are going out into the field. And we certainly can't touch on all of that. There was part of the question that talked about younger onset. Even that's a great example of, there are studies around things like the dominantly inherited Alzheimer's network. Families who get the disease almost guaranteed generation to generation in their 40s, who've committed their lives to being part of research so they can understand the disease. And Pennsylvania has sites that are doing that research. And so what I would say, certainly if those are interested, you had our 800 number, but also places like trialmatch.org are a great example to hear and see more about research going on in your community and be able to have that conversation, because thankfully, because of the investment in the US, we're seeing that change quite a bit. So thank you for that. And as I look at our time, I think, I want to be respectful of folks' time, and for each of you, there's probably one or two questions we have here to touch on last. And so as you think about that, maybe the big one is, anybody who is with us today, as they think about Alzheimer's disease and dementia and the questions they have and what's happening in their community, right? Tom, to your point, there's a lot to keep track of. From your perspective, what's the one thing you hope people take away from today? And what's the one thing you would encourage people to do if they're interested in this cause? And so maybe we'll go back to the Brady Bunch style. So folks have switched around a little bit. So Corey, you are now on the top left. And so maybe I'll start with you as you talk about one thing to take away and one thing to do if folks are inspired.
Well, I would say the one thing to do is to talk about it, to bring this topic up to all different circles of populations. I wanted to comment too on the conversation about the person, the police officer, who maybe didn't approach the situation the best way. I think something that we should also be considering is the education in businesses and maybe in that emergency care fields and other fields, in that it would improve the quality of life for people who may already have a diagnosis and for the caregiver. So what I mean by that is I can still picture my mother-in-law trying to go to the grocery store, taking my father-in-law, and he has to go to the bathroom. And she had no way of getting him into a restroom because it was a male restroom or a female restroom. So just even how restaurants, businesses may have some environmental changes that would help people with, so there's that family bathroom, not just for children, but looking at it in a different term. And how do we educate then the staff of those facilities to recognize that, you know, that man who may have thrown some food on the floor off the grocery shelf is confused. It's not, this violent person. So I just think that we have a lot of education to do, and I would really encourage us to continue sharing the education, and I would encourage people to talk about what they've learned and to keep asking questions and probing on what can we do better, how can we better serve those members in our community.
Thank you. Thank you so much, Corey. And in fact, I know one of our speakers is here. So Jessica as well, I'd ask if you wanted to open your line as we go around, if there's things that you would encourage folks to look to do.
I would say definitely to talk about it, definitely to attend an education session. There's a lot that we don't know and that we're curious about, and getting the information is just the start. That'll help bring the stigma down. And once that stigma is broken, it'll be so much easier for us to find a cure, to continue to help more people, and to be supportive of one another. So getting educated and then talking about it.
Thanks, Jessica. Tom?
Yeah, everybody keeps stealing my my takeaway. Yeah,
I know, I feel bad whoever I'm going to come to last. So.
Yeah. So the education, absolutely. And the other thing I would add to that is the organizational outreach. If you don't have a big budget for marketing and advertising, you can do things as like what we're doing right now. And is that, connecting with these groups and offering to be part of their forums and their panels, so that that's another form of exposure. And there's just that's minimal cost. That's just something else I would think would be definitely beneficial. So there was another piece. What was the other piece you wanted? You wanted to take away, and what was the other piece?
Well, if there was a call to action, if anything from the questions that you'd encourage people to do.
Well, yeah, and okay, thank you. The call to action would be, to reach out to these organizations. Like I said, if you reach out to one of us and it's better answered by another group, then hopefully those organizations would say, hey, I hear you, I understand your concerns, but I think that would be better answered by the YWCA, where I think you really ought to refer your clinical questions to Dr. Everett or LGH, or things like that. I think so we can all help each other is the way I would the call out there.
Wonderful. Thanks so much, Tom. And as you said, as folks run through, Jacqueline, I would have you up next.
Thank you. I would say that, again, to echo the education, getting that out there, conversations about it, just like many chronic illnesses, everyone knows someone that has a diagnosis or it appears that they may have a diagnosis. So normalizing the conversation so we can break the stigma and it becomes just an easygoing conversation where people feel comfortable enough to ask for help for their loved ones, for themselves, whatever the case may be. And becoming involved, again, becoming involved in any and all events that come up that touch this topic, if it's one of them that is dear to your heart.
Thank you, Jacqueline. And Dr. Everett.
Yes, I feel like I might have a summary of what everyone has already given, but really, what comes to mind is just, my takeaways, understanding the importance of having a shared space for that dialogue and having folks from different sides of the coin, different areas of expertise. So we're really looking at this type of a social issue, Alzheimer's and or dementia, from every lens you could think of. So talking about it, but also just learning about it and then looking for it. You know, it's often helpful to kind of have an understanding of the initial signs, and then you can say, oh, you know, this might be nothing, but hey, let me go in and look into this. The same way you might have a mild ache and you say, oh, it might be nothing. I might have kind of had a bad sleep, but I'm going to go and look into it because it's been there for a few weeks. Something like that is how we can start to think about having the best possible outcomes, because we're then looking at early stage processes. And of course, once you do learn about it and look for it and ultimately have a diagnosis, you can really end up having a lot more help and a lot more support. So you're finding that you're having an ability to compensate in certain lifestyle ways because you know exactly what it is you're dealing with early on, and can shift that as time goes, and ultimately just feel like you are connected to other people. So I think those would be the areas that I would think are of greatest focus.
Wonderful. Well, thank you so much. And before I turn it over to our host, just thanks to each of you for all. I know in the chat, there have been a number of additional resources. And to some of that conversation, many of the organizations on your screen today will also be together March 23rd from 2 to 4 at the Esdale High Leadership Center for a community forum around Alzheimer's disease. And how do we make a bigger difference around this disease in Lancaster County? So thank you again for your time. And Kevin, I'll turn things back over to you.
Yeah, just quickly, thank you all participants here, those of you who are active in the conversation in the chat. Great questions, great conversation. I'll give you my call to action. There's a number of nonprofit organizations here who can use your money. So please continue to support financially. Advocate at the county commissioner level to continue to provide sufficient funding for the Office of Aging, and just continue to sort of reach out to your doctor. Make sure you have a primary care physician, make sure you have a specialist where it's needed. So just being involved in those places around this continues this conversation. We're glad to continue to host these. That's part of what our resources are when you send them our way, but there's a bunch of opportunities here to find ways to get involved as volunteer, whether that's giving, whether that's advocating. So we deeply appreciate all of that. As you go forth on your day, just remember that we did record this. We will send it out in a wrap-up email to you all. So for those of you who have friends or colleagues who might have benefited from this and didn't come or weren't sure if it was for them, please feel free to push that link out so they can watch the video later on. Again, thank you all so much. Clay, great job. Thank you so much. Going to have you back as a moderator for sure. Take care, everybody. Have an absolutely wonderful weekend.